Dr. Saggar, thank you so much for joining me this morning. So, as we head into the summer months, what are you seeing right now that concerns you most about summer travel safety?
Sure. I think the best thing, it's not a concern, is that people should be empowered. And that empowerment is based upon really where they're going, what their itinerary is, what their medical conditions are. So really, it's it's about not being concerned about being having a comprehensive travel evaluation before you go, understanding and being prepared for while you're there, and also understanding that travel evaluation and travel medicine also includes when you come back, because many diseases that one may acquire abroad may not manifest, may not show itself until up to a year in the case of malaria when you come back. So I don't want people to be concerned. I want people to enjoy their summer trips, but to really be empowered and understand what the risks are, how some risks are amplified when people are traveling, and certainly have an individualized evaluation so they can make the best decisions and be prepared to have a healthy and happy trip.
So, what does that individualized evaluation
Sure.
look like? What are the risks that travelers
Sure.
maybe underestimate the most before going on vacation this summer?
Yeah, I can walk you kind of through the way I look at it. First of all, where are you going? What time of the year are you going? And what kind of trip are you doing? So are you going in the summer versus the winter, the wet season versus the dry season, the monsoon season versus a different time of the year where there may be like respiratory viruses like influenza or COVID-19. So really understanding the time of year is very important. Understanding where you're going, every region, every region within a country has its own unique potential risks. A lot of times people will tell me, well, Doc, I'm going to country X. Well, where are you going, country X? I'm not quite sure. I don't have my itinerary. That's not really helpful because certain diseases, certain what we call vector-borne illnesses that are spread by different animals, like let's say mosquitoes, ticks, etc., they may be an issue at low altitude, but maybe not an issue at high altitude. High altitude carries its own risks. If someone's just going to the capital city of a country, they may have less to worry about than if they're going to more rural areas. Also, what kind of travel are you doing? Are you going just in a travel group and going to museums and restaurants in the city? Probably much less concern. Are you taking adventure type of travel where you're going into, let's say, rural areas, into jungles, into forests, on safari? Are you going to be doing more adventurous things like riding bikes or whitewater rafting or water sports? There's unique risks associated with these kind of activities. So you can imagine really having an understanding of one's trip. And of course, probably the most important is looking at the person who's traveling, their own history. What medications are they taking? Are there any drug interactions with any of the medications I'm going to give them? Making sure they have all their medications, making sure that they're prepared, understanding what their risks may be because they have underlying heart disease, because they may have lung disease. Maybe they have a history of cancer and are taking chemo and thankfully in remission, but there's still risk factors associated with that. So it's a very comprehensive approach that we employ at our travel care clinic.
Yes, and it's so important. So, are there any certain illnesses, infections, or health risks people should be especially aware of right now when traveling internationally?
Infectious diseases are what people always think about. Doc, I'm going to this country X. I don't want to get a very exotic type disease. Remember, the most common health injuries that people acquire when traveling abroad are two things. One is injury, and the second is heart disease. Just like heart attack is one of the major killers in the United States, it's also the major cause of what we call morbidity and mortality. That is disease when people travel, as well as injury. Why? Because when people are traveling, sometimes they let their guard down. They drink a little bit more. They don't normally smoke cigarettes, but maybe they will. Maybe they'll say, you know what, I'm on vacation. I'll eat more. I'll eat saltier foods. I won't worry about my diet. I'll take some more risks. Maybe I will go ahead and try that one-legged scooter and scoot around, when I normally wouldn't, and I may fall and have an injury. And so heart disease and injuries are the most common. Injuries also can include things like motor vehicle accidents. People may drive faster than usual. They may say, you know what, in New Jersey, I would never drive a motorcycle, but here I am in Thailand and I'm going to try a local scooter because I think it's really cool and I'm on vacation and why not? And then they get injured. So people really have to understand that those are the two major causes of illness and disease and unfortunately death when people travel. But there's a whole host of infectious diseases that we need to be worried about. That's really individualized for where you're going. So just for example, I have a lot of patients and a lot of clients who are coming to me saying, Doc, I'm going to West Africa, or I'm going to East Africa, and I'm going to Tanzania, Kenya for safari, or maybe I'm going to the Amazon, Peru, Ecuador. I want to go to the Galapagos. I want to go to the Amazon rainforest. I want to go to Machu Picchu. Well, all of these that I just mentioned have very unique risks associated in terms of infectious disease. We think about things like malaria. There is no vaccine for malaria, but there are what we call pills you can take, known as prophylaxis. Um, Typhoid, which is a bacteria, Salmonella typhi, causes typhoid fever. Well, there is vaccines for that. Now, if you're going to a city and staying at hotels, I might say you don't really need it. If you're going on safari in rural areas and staying with local people and staying maybe you say, hey, I'm a type of traveler who likes to try local foods, things like that, drink local water. I'm not as careful when I travel in terms of the kind of food that I eat. I really want to have an authentic experience. I would say, hey, you should get the typhoid fever vaccine. The most common infectious disease that people get is traveler's diarrhea. And I always tell my patients nothing ruins a trip more than diarrhea when you're on a bus for 3 hours in the middle of nowhere. And so we oftentimes will give antibiotics that people should take, what we call empirically, to prevent against something called traveler's diarrhea.
What are some common mistakes travelers make with, like you mentioned, food, water, and even heat or exhaustion while they're away from home?
Sure. Yeah. So, things like not staying hydrated, especially in women, we see an increase of the women getting urinary tract infections. We see it all the time in the United States as well. You don't hydrate, it's hot, you're moving from place to place. Sometimes you might be in rural areas and you don't want to necessarily use the restroom, so you hold it in, so to speak, and then you see an increase in urinary tract infection. This is a very simple yet a very, I think, powerful example of how, something very small can become very large when you're traveling. Um, you know, I'll talk about things like forgetting your medications. I always tell people, it's very common. Smaller bathrooms, you're traveling abroad, you put your medicines on, let's say, a shelf, you knock it over, it goes on the toilet. What do you do? So always make sure you have a copy of your prescriptions that you can get so you can get medications and refills as needed. I always hear about people saying, I forgot my medications, and people seem to think if you forget your medications or run out of medications on vacation, then it's okay because you're on vacation. That's really the mindset. People kind of change their mindset. Even if they're very disciplined about taking medications, adhering to a diet, etc.
How far in advance should people start talking
Yeah.
or thinking about vaccines or travel medicine before a trip?
Yeah, this is a great question because oftentimes I'll get a last minute request. I'm going to country X halfway around the world next week. What should I do? And the first thing I'll say is that we'll try to do the best we can, but you should have had this conversation several weeks ago. If we talk about things like yellow fever, typhoid vaccines, they take 2 weeks after you get the vaccine to have full immunity, right? So you want really to do this a month, 2 months, 3 months ahead of time. I'll also make a note that some countries, to even get a visa, you have to have evidence of the yellow fever vaccine. I had currently have a large group, a church group going to West Africa and Ghana, and they needed to do this travel evaluation several months ahead of time, just so they could go to the embassy and get a visa, and the visa would not be granted unless they've had the yellow fever vaccine. So they did it, in a great, they were very good about doing it 3, 4 months ahead of time. So I would always say the sooner the better. Certainly, for many vaccines, it can take 2, 3 weeks. That includes influenza, COVID-19. It takes several weeks for your body to mount a response, right? So if I give you vaccine X, you're not all of a sudden protected. You have to have your immune system ramp up, start producing antibodies against that specific target that the vaccine is giving you immunity for. And so understanding that probably say a minimum of 2 weeks, but really a month, I would say a month to be safe.
Thank you. If someone is traveling internationally this summer, what's one thing they should absolutely do before they leave?
A couple of things actually. One is if you're going abroad, we live in a world that's global, that's connected, but also that is constantly in flux, both politically, etc. So always considering registering with the embassy in the country that you're going to. The State Department actually has on their website a link that you can let different embassies know that, hey, I'm traveling to country X. So God forbid there's an issue, the United States government's aware that you are there and they can offer help. So that's actually something that a lot of people don't realize. I always encourage, right? So it's not just if you're going to a war-torn area or an area that's undergoing civil war. We all know that political strife can happen at any time. People can get in trouble. People may need the help of the federal government. And by having yourself registered, it's just an extra insurance that, if you needed help, that a local diplomat, that the embassy in that region is aware that you are there and can just start that process that much faster. That way, what if you're injured? You need to be medevaced out. What if there was a death with someone who's traveling, et cetera? That really just helps in a difficult time to relieve some of those logistics. Another thing I would discuss is also, based upon one's health and what they're doing, do they have health insurance? Do they have overseas health insurance? I like to discuss that with people. Someone who's very young, they might say, well, the chance of something happening to me is not so great. I don't need it. What if you're older, but you're still very active, but you have certain what we call comorbidities? I mean, you have certain health issues, discussing. So again, as we know, the travel evaluation is very broad. I would say very generally, anyone going abroad, going traveling should really just be prepared. And I think that's the key word here, being prepared. Being prepared can mean many different things. But for our discussion here today, you can see it's very in-depth, it's very detailed, but being prepared, and I don't mean just packing clothes and knowing your itinerary, being prepared medically will ensure you have a safe, happy, healthy trip. But you're prepared, if something were to happen. So as we say, always hope for the best, prepare for the worst. I think this applies to traveling abroad as well.
Dr. Sugar, thank you so much.
My pleasure. Thank you for having me.